Hello everyone, Dr. J back again for another video on beginner basics for lumbar extension with rotation syndrome. If you have decreased abdominal corset bracing ability, you will have excessive stress and strain that collects into the lumbar spine. Our research over the last decade has showed that female patients with abdominal surgeries are 10 times or more likely to have lumbar pathology. When we violate the abdominal wall and we don't restore its ability to engage and brace, the lumbar spine will take extra stress and strain. Next, if we have limited hip mobility, range of motion, mobility or flexibility, we'll also get excessive lumbar extension and rotation. If I don't have it at the hip, the stress has got to go somewhere, either the knee or the back. Having a safe chair that won't move on us can allow us to brace our spine, start to loosen the ankle, knee, and hip. Depending on the height and size of the patient will determine the height that you need to do this movement. Some patients need to do this on their steps with railings to warm the body up, to walk, or to function that day. We can do dynamics. Notice that my spine is staying in neutral. Maintain normal breath in the nose, out of the nose. 5 to 10 times would be a starting dose. We could even do more. Next would be hip rotation, and again, having the right height and setup for safety really matters. So if I'm holding on to something stable, I can start to open my hip into external rotation. If you're feeling this in your back, you're not doing the movement correctly, or you're not bracing your lumbar spine. As we change positions, the deep corset muscle has to work automatically to stabilize the spine, which is how we actually move. Pelvic tilting can open up the front side of the hip by releasing a tight or restricted tensor fasciae lata. We can also lose adductors. There's even things that's occurring into the spine clear up into the quadratus lumborum. If I don't have the hip rotation, I will definitely have stress and strain in the lumbar spine. Notice I'm keeping an upright posture. I'm feeling this through the pelvis, not the back. The limb that you're standing on, if it's weak, you want to clench the buttock to stabilize the hip, to stabilize the pelvis, and to decrease rotation and side bending into the lumbar spine. If I don't have adequate pelvic control through gluteal activation, I will definitely have more stress and strain in my back. These would be beginner level basics for causes above and below that causes excessive stress and strain into the lumbar spine. If you liked our videos, please hit the like button, the subscribe button, and please share it with your friends and family. Thank you.